to the uh, welcome everyone to the June 11th educational webinar from the Healthcare Workforce Committee of the Oregon Health Policy Board. And uh, today we are going to discuss workplace wellness. So topic near and dear to many of our hearts. Just a little bit of uh, housekeeping before we get started. Uh, this meeting is open to the public and will be recorded. Transcriptions and the meeting recording will be available on the website as soon after the meeting. So that said, I am going to pass this off to Elena Shablowski, who will talk to us a bit more about her work with workplace wellness. Elena?
Sure. Good morning, y'all. My name's Elena Shablowski. I use she and her pronouns. I'm a dentist at La Clinica, which is a federally qualified health center in Medford, where we're enjoying much cooler temperatures today than we did the last 2 days. I'm just going to give a couple minutes of brief remarks before we get to hear from Neon today, and to give some context of like where has the workforce committee been on wellness and resiliency in the past? Why are we having Neon talk to us today? Just a bit of a history moment. So while wellness and resiliency, of course, has always been important to the committee, in my tenure on the committee, that was really solidified as we broke into three subcommittees in 2023, and throughout the year worked on these three strategy papers. And they were diversity in the workforce, recruitment and retention, and then wellness and resiliency. If you're curious to read those in their entirety, they're on our committee page, or I'm sure Deepti could send you a link. And one of those, so I got to chair the group that was working on wellness and resiliency. And through the course of the year, we invited different organizations in to talk to and learn from. And Neon was a name that kept coming up. And so they've been on our radar sort of since those conversations in 2023. I'm really excited. At that time, they were doing some really innovative and like good community building, good grassroots efforts to think about wellness strategies within organizations in Eastern Oregon. And so I'm excited to hear from them today, see what's been happening over the last 2 years. They are still listed in that strategy paper that we made under the resources tab, because we just believed in what they were doing so much, and believed that their work would continue to be evergreen and sort of a North Star or a guiding light for wellness and resilience work in healthcare within Oregon. And so I think I will leave it there, and let the experts take it from here. And so I will pass along to Edna. Are you kicking us off?
Yeah, and then Lisa today.
And then Lisa, awesome.
Thank you.
And Lisa, thanks so much.
Great. Yes, thank you for welcoming us today. We do have some slides for you, and then we're going to have near the end a little bit of a practice thought exercise activity with one of our tools. And I think they have the slides to share with you all. So,
oh yeah, there we go. I was like, I let them know that you would love to forward the slides. So I
yes,
see you're
I
sharing now.
Yes, I have forwarded the slides, I think, to Deepti, and I've got them displayed for you all today. So we will swing in. So first of all, let's just do a little bit of an introduction of ourselves. My name's Lisa Leidendorf. I use pronouns she, hers. I'm a licensed clinical social worker and a trained community health worker. And I have an over 30-year history of working in behavioral health, public health, community health, and organizational health and wellness. And we'll talk a little bit more about our organization's entry into this in a moment. So I'm going to pass it to Edna for a brief introduction.
Good morning, folks. I'm Edna Marietta. I use pronouns she, her, hers, and I am the program manager, training program manager of Neon. I'm celebrating 4 years, and I am also a trained community health worker. Prior to that, I worked in higher education. And yeah, I'm excited to dive into this conversation. And thank you for that introduction of us. We are very passionate about this work. And so to get the opportunity to sit in front of 30 other individuals to talk about what we're doing and what you all can start doing in your work environment is really exciting.
Yeah. And I'm sure a lot of what we're going to talk about today is going to be very familiar to many of you. Hopefully, at the end, when we talk about a little bit of a practical tool to use, this may be of interest to you, your organizations, or the networks that you work in to pass along. So, what we'll be talking about today is integrating workforce wellness into everyday organizational decisions and our learning objectives today will be to gain a greater understanding of how staff well-being impacts quality, safety, and retention in the workplace. This will probably cover pretty quickly because for this audience, you all are extremely well grounded in this, and I don't want to spend time covering things that you all know very well. The second will be to become familiar with the Surgeon General's framework for health worker well-being, and I imagine that many of you here already may know about this. If you spend any time working in healthcare worker well-being in the last several years, this is probably something you're familiar with. If you're not, it's from our prior Surgeon General and is a wonderful tool with lots of resources already attached to it. It is still posted online as of our most recent checking, which is good because there are a lot of tools that go with it. And then finally, we'll spend a few minutes practicing using a little assessment tool that we've created to help leaders at all level within an organization. And I'll just say that we consider leaders to be in an organization. Anyone who's making decisions on a daily basis in an organization is a leader within an organization. So that's pretty much everybody. How to promote staff well-being in every decision they make, whether it's an official wellness decision or not. So a little bit about who is Neon. We're a nonprofit health collaborative focused on primarily public health. And I'm going to let you read a little bit there about what our organization does. Edna and I are with our training and consulting program. We do work statewide. Last year, we reached 35 out of 36 counties, trained over about 750 individuals with 230 organizations in 35 of 36 counties. And we focus a lot on what we would call the unlicensed health and social service workforce is where our focus is, as well as the supervisors and executives that support them in their workforce. So not that we won't train others, but that is a lot of our primary focus in our market. And we began focusing on compassion fatigue and burnout many years ago when we had requests for that training, and really launched into workforce wellness in 2022 when we were one of 42 grantees for an initial pilot grant federally. It was a HRSA workforce wellness resiliency grant. It was the first time the Bureau of the Workforce Bureau at the federal level had focused a grant on retention of employees and not just training or recruitment. I will say that grant, they're currently trying to refund it. We haven't been successful yet, but we are advocating for refunding of that so that others can continue to participate that and get that particular funding source institutionalized. But that allowed us to really drive forward. And in that, we sharpened our focus that while we do have some individual self-care trainings, the bulk of our training that we developed when we focused on research was on supervisor training and mid-level leader training, as well as some executive training. The idea being that while individual self-care is healthy, is helpful, you can do all the individual self-care in the world that you want, and if you're working in an unhealthy system, it's not going to have the long-term end result that we want. So that we need to focus on helping supervisors and leaders really develop and craft healthy systems. So that is a lot of our primary focus with our workforce wellness. So please pop up with questions at any point, put them in the chat. I think Deepti will help monitor that as well as Edna and I when we're not speaking. So these numbers, I'm sure you're very familiar with. 40% of workers indicate that their job negatively affects their mental health. It's interesting that that goes up to 47% for workers under 30. So we're hitting pretty high numbers there for younger folks. The cost of depression alone, and this is across all industries, not just healthcare. So we're not even looking at other mental health conditions there. Depression, of course, being one of the number one costs for lost days of work, absenteeism, presenteeism, lost productivity, etc. So this is a huge impact on our workforce and our workers. This slide is a little bit busy. What I want to call your focus to, and again, this is general to the entire workforce, not just healthcare, but I want to call your attention to the left-hand corner down here. Factors that influence mental health. Folks generally say that 45% about, say, managers have a positive influence, and that coworkers, almost 50%, have a positive influence. It's the job itself that has less of a positive influence. So these are things in the work factor, factors in the workplace, the work culture, non-human factors, organizational factors, culture factors, things that are less specific to my coworker and my manager, which leads us to, again, to the idea of organizational change is really what we're looking at here. So again, these are things that are very familiar to you. When we present this to executives, we of course talk about the bottom line. We also talk about the human cost, but really we see the cost of this showing up in absenteeism, increased disability costs, turnover, healthcare costs, productivity. There's extensive research on this. And of course, the human cost in terms of folks leaving the field, and particularly in healthcare where there are not readily available trained up providers to take folks' place, and it takes a long time to train a new provider. This is very problematic for our healthcare system. Burnout, particularly, even more than other mental health conditions, has been studied quite a bit. And it consists of emotional exhaustion, depersonalization, and reduced personal accomplishment. So workload is considered to be a strong mediator between burnout and patient safety. Particularly, provider perceptions and patient satisfaction in research are directly affected by worker burnout. So when worker burnout is high, the perception of the quality of care that provider provided and the satisfaction that the patient has go down directly as worker burnout goes up. And as you might guess, emotional exhaustion has the strongest relationship between errors and adverse events in the healthcare system itself. So particularly that element of emotional exhaustion, we see increase in safety events. So employees are more prone to making mistakes and ignoring or overlooking safety protocols when burnout is high. They either forget them, they cut corners, they're too tired to do them. They also may take unnecessary risks. And burnout leads to slower task response and lower accuracy, all of which are associated with higher error and patient safety risk, as well as worker risk. So these are some of the ways that burnout particularly translate into risks for patient safety and quality, not to mention the impact that we have on the employee. And then finally, retention. So turnover, if we're measuring retention by the time people leave, we're measuring it too late because it's already happened and there's nothing we can do about it. So recommendation in the literature is that folks measure turnover intention within 6 months. Are you looking for a new job, or do you plan to be looking for a new job within the next 6 months? Because at that point, there's something that you can do about it within your workplace. So turnover intentions really are related to job satisfaction and burnout. When we look at why folks intend to turn over, there are, of course, internal factors, individual factors, such as how far do I live from my work site? How far am I driving? What are my family factors? And those are things that a workplace really can't do anything about. But things that a workplace can do something about are related to job satisfaction, and job satisfaction and burnout are very closely correlated, so that folks that have high burnout levels really have low job satisfaction. It's also job satisfaction is closely tied to discrimination in the workplace. So that when discrimination is taking place in the workplace, typically job satisfaction is much lower. So those are some factors that the workplace can do something about before the turnover actually happens. So this is a fairly simple model for turnover intention. And up here we have negative factors. So if job demands are high and burnout is high, turnover intention is going to be higher. If job resources outweigh job demands and job satisfaction outweighs burnout, then turnover intention is typically low, all other things being equal. And by all other things, I mean personal factors being equal. And so job resources and job satisfaction are the levers that an organization has to push on within the workplace to manage turnover intention. This slide is one that is really put in for your reference if you're interested in diving more into the issues related to turnover intention and job satisfaction. And in the notes section, which you should have with the slides, it'll cite the source for it. This comes from nurse staffing, but is applicable to other models as well. Most of the research in healthcare for burnout has been done with nurses and physicians. Very little has been done on any other occupation. So we sort of have to rely on that and extrapolate. But it takes a look at what are the levers here that you have to work on in terms of interpersonal conflict, feelings of self-efficacy, what types of decision authority do folks have, communication satisfaction, etc. And some of this is going to come into play in the Surgeon General slide when we get to that. So this is mainly if you're really interested in all the drivers that go into turnover, intention, and job satisfaction for you to study later. And then finally, we just wanted to touch a bit on DEIB because this is going to be key in the Surgeon General's model and as we go forward. And we wanted to be clear what we mean when we talk about that. And we do train on it. It's central in all of our trainings. And we did not come up with this concept. This is borrowed from DEIB educator Arthur Chan. And how we present this to audiences that we train on is that diversity is really a fact. Equity is a choice that we make, and we enter our trainings and our consulting work just stating to the audiences that we work with that we are making an assumption that equity is a choice that they want. And that's and if they don't, that gives them the choice to say, this training isn't for me, and you are not the consultant for me. But we go in with the assumption that equity is a choice they're making. Inclusion then are the actions that we take. And inclusion are the actions that are counter to discriminatory actions. And as we'll see in the next section that Edna is going to present, inclusion is sort of front and center to a number of the aspects for a model for mental health and well-being in the workplace. And then the outcome that we're looking for is belonging, which is that everyone feels like they truly belong within that workplace context.
All right. As mentioned at the beginning, the tool that we're using is in reflection of the Surgeon General's model here. And what we want to highlight is just a couple things. This structure has intentions in being a starting point for organizations and updating and institutionalizing their policies and practices. Keeping in mind, and it's so well focused there in that graphic, it's centered in worker voice and equity. So when we elevate the whole person in maintaining structures of support rather than harm, the long-term health and well-being of all workers is at play. And so we really came up with a great tool that will help assist you all and be complementary to decision making while maintaining and balancing all of these components. There, as Lisa mentioned, there's a lot of information that goes into a deeper dive of all of these sections and active things that you can do and partake in to assure that you're meeting all of these elements. But today we're going to kind of broaden that out a little bit, and then focus in on a decision that we might have come into this space with and kind of go through that model. So I'm going to walk us through. Oh, so these are actually some highlights of it, and we don't want to
Did you want the next slide yet? Sorry, Edna.
Yeah, that's fine. Yeah. I'm gonna do this briefly because we definitely want to keep time to walk through the tool today that we're gonna use, but taking a deeper dive of each of those sections. So protection from harm, it looks like prioritizing workplace, physical, and psychological safety, which we'll be covering. Connection and community. And one of my favorites there is fostering collaboration and teamwork and being like actively fostering collaboration and teamwork, not just encouraging it, but putting systems in place to do so. Opportunity for growth, offering quality training, education, and mentoring. We see that there's typically a decline, and especially right now when everyone's kind of in a survival mode, a lot of these opportunities for growth kind of go right outside that window. And a lot of opportunities are missed for employees continuing and maintaining and retention with them. Next slide, Lisa. Mattering at work, which is really the heart of probably one of the ones we struggled with the most when putting together that the tool that we're going to use, and really centering all of these elements around equity. So providing a living wage, and what does that look like for your organization? What does that mean to the individual? Engage workers in workplace decisions, being active in engaging folks in workplace decisions, which again, the tool will walk us through what that could look like. And then that work-life harmony. So increase access to paid leave, respect boundaries between work and non-work. Okay, that was very fast, and that's because we want to leave time for this awesome tool that we've created. So the purpose of this tool,
Sorry.
it's okay, is really, it's just a way to maximize well-being benefits for staff. And as Lisa mentioned earlier, these are individuals or leaders within the organization that are in charge or leading decision-making processes. And so there's some components there, and we're going to have the document so you'll be able to see this a lot larger. But we kind of outlined how to use that tool. So if you come across needing something, supplemental document like this, and you have a decision that you're wanting, or maybe staff members that come to you and you're like, okay, I definitely know I need to make a decision on something, and maybe you've identified something that people are wanting change of. You go to, you start at one and identifying that, you go to two and reflect on whether your decision can impact each element of well-being. So on the tool, we take you through questions. So you'll either answer yes, no, not sure, and then what notes? Maybe there are things or components you need to go back to and ask more questions of your team in order to move forward. And then if yes, then use the question to determine what opportunities where there might be change in practice policies. etc., as you make the decision that can drive forward well-being. And that's really the mission there, is to drive forward well-being. Okay, and Lisa's going to prompt that for us.
So there's a couple things I will say before we dive into using this. One is when we've worked with systems and we've had an opportunity to work with some large healthcare systems, there's been a couple things that we've noticed. So the executives will tell us, I'm too busy. I don't have time to engage in this. But they have sent entire middle management teams, and I mean 100 people, to 6-month long trainings for supervision and mid-level change, which was a significant amount of time paid for the training, sent the time away from their work to have their supervisors and mid-level leaders from their system come to a 6-month long training for skills building, which tells us there's an implication that say that they think that the issue lies with mid-level managers. And the mid-level managers and supervisors were very grateful for the training, because one of the things that happens in healthcare and social services is that people are promoted because they're good at their job. And they're rarely, if ever, given any supervisory training that teaches them really how to mentor and support staff in the workplace. So it's not that they weren't grateful for the training, but they kept running into a wall with system change with their senior executives. And we would hear that loud and clear when we would have 50, 60, 80, 100 in these large healthcare systems that were working with us, moving their mid-level executives through. And the top executives would say, we don't have time for this. And of course, our assessment is, if you have, 60 to 70% of 100 of your mid-level leaders in your very large system saying they think you need to do something, maybe it's time to make time. So we also had a lot of small systems that we worked with that said, I would love to do this, but I don't have the resource to do a big wellness initiative. So the strategy in this tool is that you don't have to do a big wellness initiative. What you have to do is pay attention to every single decision you make as a leader and say, does this decision drive us more towards wellness, or does it take us away from it? Because every single decision you make as a leader can integrate wellness, can change your culture, or can keep your culture where it is, or can move your culture further away. So that part of it is that every decision you're making as a leader is influencing your culture, whether you're doing a culture change initiative or not. So you don't have to do a big culture change initiative. You can just embed this in your thinking day to day as you go. So that's one thing. The second thing is that as we've trotted this out around the state to various audience and presentations, the biggest aha that folks have had as we've workshopped this is that the questions seem easy to them at first. And then we say, stop and think about, how would your employees answer that question? And that becomes more difficult. And sometimes they say, I don't know. And we say, well, then you need to go find out. Other times they say, oh, my employee would answer this differently. And they'll say, but I don't agree with my employee's view. And I say, that's okay. You don't agree with your employee's view, but remember that the answer to the question, if you're wanting to drive forward wellness, is your employee's answer to this, not your answer to this. And it's not about who's right and who's wrong. When it comes to the issue of wellness and mental health, it's about the perception of listening to the perception of the employee. So our question is, are any of you working in systems currently trying to make a system decision that you'd be willing to workshop here? It can be something you're trying to do with a workflow, could be something you're trying to do with a schedule, could be something you're trying to do with work from home, bringing people back into office, could be something to do with an EHR, new data collection or reporting. We're just curious if any of you have a decision you'd like to workshop that you're trying to make. Give us a chance to try it out. Anyone? we put it this way. Does anyone know a decision that a friend is working on? Anyone have a decision that a friend is working on, or know of a decision that someone in a system that they consult with is working on?
Quick question, Lisa. So are we talking about like you're referencing specific decisions, like programmatic decisions within the workplace? Is this a tool that could be applied to like kind of general program development?
Yep. You can apply this to program development, specific, you can policy, program, strategic, big, small, anything. Mhm. Yes. So Amanda asked if we could provide an example. Yes. So the last time I did this, I actually did this at a workforce board conference. Okay, good. Glad to know the exclamation point was an accident there. So yes, the last time I did this just a couple months ago, it was actually at a workforce board conference, and we were working with some small employers. So they were not in healthcare, and I was working with someone who had about 30 employees, and they had an office they had to staff, but a lot of their work could be done from home. And so over COVID, they had settled into, or after COVID, everyone had worked from home, and then they'd settled into everyone worked from home 2 days, everyone worked in the office 2 days a week, and they worked from home 3 days a week was their current situation. But they were having problems staffing their office functions. More people were coming into the office, and they were having problems staffing their office functions. And the reality was they were needing to go to people in office 3 days a week and working from home 2 days a week was the business decision. And this person knew that that was going to be a really unhappy decision. So we walked this through. So, for example, we went protection from harm. And the first thing I asked her was, are there any risks from harm? And as the executive owner of the business, she said, no. I said, great. What would your employees say if you asked them that? And she went, I said, are they going to say there's any harm to them? Physical, psychological, stability, um, for coming back into the office 3 days a week? And she goes, ooh, yeah, Rob, you said so she's like, actually, probably, yeah. I said, like, for example, do people have to work at night? She said, sometimes they do. I said, do you have adequate lights in the parking lot? And she said, actually, we don't. I said, okay. Does everyone currently have adequate daycare, and how easy to find that is they? And would they feel like they're leaving their young children in an unsafe childcare situation if they came back into the office? And she said, they might. So when we unpacked that, something that on the face of it she thought would have absolutely no safety risk, when we talked about it from her employee's perspective, possibly there was. So when we went to connection and community, does the workplace decision promote inclusiveness for all staff? I said, how are you going to figure out who you bring back into office and who you don't? Um, and she's like, well, I haven't thought about that. I said, are you going to do it on volunteer? Are you going to make everybody come? What's going to feel fair? She's like, well, I think I might just make everybody take it. And I said, okay, do some people have kids and some people don't? She goes, yeah. I said, well, is that going to feel? She's like, well, if I don't make the people with, if I make everyone come, the people with kids will feel it's unfair because they have to find daycare. If I don't make everybody come, then the people that don't have kids will say it's not fair to them because they have kids. I said, exactly. So how are you going to make this decision? So then we talked about the decision-making process. So do staff have trust that decisions are in their best interest if you just make this decision? So that was the kind of example. And what she ended up deciding to do was to hold a series of sort of meetings and focus group sessions with all of her staff, sort of processing through all of this, saying, here's our dilemma, here's our resources. and putting more of the decision making and problem solving in the hands of the staff and running them through some decision making processes. Now, she only had about 25 employees, so that was possible for her to do, right? She also wasn't trying to run a surgery clinic where she had to have nursing shifts and certain shifts. So that was a possible thing for her to do. Did that example help? Okay. And we ran through all of them that way, and you can sort of see how once she began to think about how her employees would think about it as we ran through all of these, and then we said, so when it gets to living wage, are you going to provide a financial incentive for people who come back into the office or not? Can you afford to do that? Will that be fair if you do? If folks have to get daycare, should you pay them more if they come back in the office, knowing that they'll have an extra cost, et cetera, et cetera. So it raised a whole lot of questions that she hadn't thought of before. And this was an employer who really did care about the well-being of her employees. And so it raised all of these issues for her to go back and run a different decision-making process with her employer, with her employees, take a look at her budget to see what financial incentive and resources we had, talk with her employees about what their ideas were to get the needs of the business met. So does that help? Does anyone have a situation they'd like to run through or have some thoughts of just general decisions, maybe not yours, but some things running out there? And yes, Molly, you can use this if you're doing new program development. An ideal time to do this is when you're doing new program development. I mean, it would be great if you could use this when you're doing new program development and just setting things up. Does anyone have any questions about how you might use this or how any of these might work in your setting if you don't have a specific example? Yes, Amanda.
Yeah, I'm trying to think of like kind of how to apply it. I'm definitely in like the middle management area, so some of these things, it's I think my questions would be less about how to use the tool and more about how to collaboratively pitch things like this successfully to your like leadership team and
Yes.
present them with like implementable strategies.
Yes.
But maybe it would be easier in terms of using the tool. We have some grants restarting, and one of the things that we do, it's not direct to health, but I do housing justice work, and we have a housing resource referral hotline. And so we have a small team of staff, many of which are on this call, that field any sort of housing need that somebody who fills out a form that they can just access online has. There's a lot of trauma involved in like housing work, and we don't have right now, we do not have like internal training for trauma-informed care that I would think would be necessary as someone who's done, client intakes and that kind of work before.
Yep.
So now that grants are restarting, I would like to integrate that into it, but also our staff's also overworked. And so adding more training or adding that kind of extra layer is a concern.
Right.
Because I want to give them, we want to hold the best standards for our staff and for our community, but I also recognize we have a lot of limitations. We're also an immigrant refugee racial justice org, so funding has been limited further recently.
So did you want our thoughts on that situation?
I was going to say whatever, I just wanted to provide like I like this training so far, so just give you something to kind of work from, whatever it may be.
That's a great situation. Yeah. So, and I think there's a lot there, and your situation is exactly the kind of thing we designed this tool for, Amanda, where you're not in a situation where you can run a whole big wellness initiative. That's not in the cards for you. You don't have the time, you don't have the funding. So I think what you could do is sort of take this tool, and by the way, you can feel free to change the question. There's nothing magic about this tool. You can feel free to change the question on this tool to anything that suits your organization better. Absolutely. And basically sit down with your staff and see where, if you have limited stuff to focus on, where do they think the focus would be? So my suspicion would be protection from harm, especially the psychological harm, working with immigrants, refugees, and housing right now. You're right. That is rife with trauma. And if you don't have anything protective for them in that arena, my guess would be that's going to be number one. But always ask them. So, autonomy, when we get down to autonomy, the number one thing you can do for autonomy is ask people what they think and then listen to them. And what I suspect might happen is, do they really need a training, or do they need some sort of peer support or supervisory support mechanism for processing trauma? So, for example, one of the other things we train on is low impact debriefing, which is a really simple model for debriefing. It's 10 minutes to train people on, and then you set up a model for debriefing with supervisors and peers formally, so people don't have to say, I'm falling apart. You make it part of your culture to say, hey, we're working in a trauma-laden industry. Low impact debriefing is what is a tool I have. What do you all think? If we just make it a practice, you don't have to be falling apart to use it. All you have to do is have had listened to something really traumatic, and then afterwards you go and activate a peer or a supervisor who's volunteered to be a low impact debriefer. You take 5 minutes to low impact debrief with them, and research shows us that that helps people shed the impact of trauma. So you haven't taken a lot of time with training. You've used a really efficient resource, and you've used your peers, which has the goal of building connection and community, which is another element on this that's protective. And that's just a possible way you could use some other elements on this coat hanger. I call them coat hangers because I like to think of hanging things on them. That's not necessarily a training, that uses resources you have a little more efficiently. And the peer and supervisory connection builds connection and community. So now you'd have to ask them if that works for them, right? Rather than just telling them. So yeah. If you'd like more information on low impact debriefing tool, Amanda, my email's on the end of the slides. Just email me and I'd be happy to send it to you. Yeah.
And Lisa, we have another question in the chat from Dee. It says, I had a question about who actually fills out the tool. Is it usually only a manager? Do the employees also get a chance to provide their perspective filling out the tool and practice through a survey or open discussion?
We would certainly advise that all employees get a chance at it. What I would say is that it's pretty important to have leadership support before you turn your employees loose on this, because what happens if you turn your employees loose on it and you don't have some power to act on what they say is you've then kind of created a conflict. So, and honestly, I'm going to say the same thing with client satisfaction or client morale surveys. And people do this all the time in organizations. They survey client morale and then they do nothing. And if you listened to employees talk about the client morale survey in places where people do nothing, they hate it. It's terrible. It's morale busting, not morale improving. So in many ways, my advice is, if you're not going to act, don't ask employees if you're not going to act on it. It's typically my advice to leadership. And sometimes leadership doesn't act on it because they don't have time or it gets lost. And that's understandable. But you're worse off if you ask and people tell you and then you do nothing. So, but I would say that yes, I think open discussion is, if you have enough trust to get to open discussion, I actually think that's best. Because then you can ask questions. And you can ask follow-up. If someone says, yeah, there's impact from harm, I'm coming back to the office, I'm going to have to ask a follow-up question of why, because I probably don't get what that is, right? I probably don't understand what that is. Because as the owner or administrator, I'm probably in the office and I don't understand. But if you don't have enough trust to get to that, you could do a survey. I just think maybe having discussions at smaller units, maybe an immediate supervisor having that. So this is mid-level, Amanda, where mid-levels often come in. Mid-levels often having the discussions and then relaying the information up. Mid-levels typically are best suited to be translators within the organization. And that's often a mid-level is a great role to be a translator.
Molly in the chat says, this is fantastic information. I work with an org that supports home care workers throughout the state of Oregon. These folks are often experiencing extreme burnout and isolation. I think it's great to use these tools and possibly collaborate with Neon to develop a wellness initiative to increase support and retention in this field.
Mhm. Yeah, and when you know that, like when I see that, I see isolation, I see burnout, and then I see isolation. And when you know that, you can use any initiative to counteract what the main issue is. So let's go back to Amanda saying, I know trauma is the huge issue. Do I do a training? And it's like, well, do you really have the time and the money? We know that peer support is protective against trauma, and that builds connection and community, which is one of these elements. Could we use that? I'd say the same thing with Oregon. So the Oregon Home Care Commission is amazing with training for home care workers. They have an amazing training setup, but does that overcome the isolation, right? So is there some other intervention to get at something they need that could overcome the isolation? Because isolation is huge for those folks and it's probably a huge contributor to their burnout. So yeah, some of that is looking at which element of these 5 elements on the Surgeon General, if you can't do them all, which element of these elements on the Surgeon General's framework would be the most speak to their needs. So home care workers probably have a lot of autonomy, whereas someone who works in a long-term care facility doing shift work has a lot less autonomy. So autonomy, I teach some of this content through an echo on long-term care. We've talked there about autonomy. How do we bring in autonomy? Because they don't have a lot of autonomy. They don't have isolation because they're working with other people all the time, but they don't have very much autonomy. So we focused a lot on autonomy. Home care workers have quite a bit of autonomy, but their community and connection is really low. So you look at what's the element that balances that biggest need they might have. Mhm. Because in today's environment, we can't get it all. So what's our biggest bang for our buck? And that's really one of the things that where can we weave in little ways and where's the biggest bang for our buck, and not just from our perspective. So yes, from this comment here, Molly, of the discussion with the people at the end, we have to know what they think.
Mhm.
Other questions, thoughts on how you all might use this in your setting? You have our email, and there's a QR code to our website for both Edna's and my contact information. If you want to approach us later, we're pretty passionate about this stuff, about finding the small ways that organizations, we've been at this, and when we originally went at this, we thought, great, we're going to get these organizations to do large wellness initiatives. And you know what? No, we're not. No, we're not. So then we shifted and we're like, how can we get every organization to creep their way there through everyday decision making, which I think is a much more realistic approach.
Hi, this is Koi. I'm with the Coalition of Community Health Clinics, and I just, just looking at the survey question and just with experiences and working with different organizations, I feel like the first question, as far as asking about harm that's being created or experienced, is a hard question for organizations because that also creates a potential liability to the organization. So, what is your workaround, your thoughts around you know, getting to the root of the issue, but then also allowing for flexibility or space for the organization to improve, but not necessarily create a potential liability for the organization.
Right, right. Um, well, so
Because that's
one
almost
of
like an admission that you know that there is harm,
right, right.
right? So,
Well, so one of the things I'm going to say about harm is I think that we all do risk assessments for harm all the time. We do safety risk assessments all the time looking for harm. And that's considered to be due diligence. Like I'm looking for due diligence is can you can you trip on this sidewalk, right? Do we have the right what is our process and protocol for how we store, label, check, administer vaccines, medication? How do we dispose of medical waste, right? And we check those processes periodically, right? We have the processes, we update the processes, we check the processes periodically, we go through the processes to see if they work the way they're supposed to. Um, and that's normal, and that's part of our quality assurance program. So one thing I encourage is to think of this as part of our quality assurance program and to present it as such. This is part of our employee quality assurance program. And just like us looking for errors in our physical plant and errors in our medication system and errors in our infection control system, right? We're looking for errors in our employee system, and that should be fine because we do it everywhere else to proactively spot errors before harm is caused. So you could put the word potential in there. So the other thing I'm saying is I'm happy to get you all a Word document on this. There is nothing researched about this. You can change this if you want. You can put the word potential in there. You could also put the word at the top of this is this is sort of assessing for potential harms. So that's the other thing is if you're looking towards future decisions, you are assessing for potential harm, not current harm, right? So there's probably some things you could do for wording there. I think the only real issue comes, and I would submit you have this issue whether you document it or not, it's probably just easier to find if you document it, is if you know harm is going to come and you do it anyway.
Mm-hmm.
Right? So yeah.
I was just going to add as well, I think the framework around this is also the language of prioritizing workplace physical and psychological safety. And so it's being proactive and asking the questions and really putting weight on this piece of psychological safety because, as Lisa mentioned, we do focus so heavily on the physical safety of components that when we are working with employees and they're like, I don't even know where my psychological safety is. And so it's about asking those questions and putting in the forefront, right? When I hear Amanda talk about the population that she works with and the trauma that is being caused or the development of trauma in the work that they're doing, my flag of psychological safety is the first thing that goes up, right? And so if we're not consciously aware of that and prioritizing it, and as Lisa said, we might just blanket over it or decide to move forward with the decision. Like, I think that's really at the heart of prioritizing it and why we're asking it very explicitly.
Right. So I think to me, I think the main risk would come is if you sent this out as a survey, which I'm not necessarily recommending you do. But if you sent it out as a survey and people said yes, and then you went ahead with the decision anyway, or you ignored the feedback. But I think that's a problem with lots of things we do anyway, like our morale survey where we ignore the feedback or, those kinds of things. So, and I will send Deepti the Word document of this. And like I said, feel free to change the wording to something that fits better. If there's concern about those words, you could say potential. But I would encourage this to land somewhere, even, I mean, you can land it in HR, you can also land it in QA/QI and say this is a quality assurance. And it really is when you look at how it connects to safety and quality issues, it is QA/QI for the services we provide. When you look in the literature, it's about the direct links to error, safety, and quality.
Yeah, and I appreciate what you said in regards to the, conducting a survey and not having the resources or just the action after the assessments, and it creates worse. The intention's great, but if there's no action, then it creates, a decrease in morale. And I've seen so many organizations that, have those intentions, but they don't put in the time, resources, or
Mhm.
and the training to actually make some of the to improve or respond to some of the assessments that they received. And so that's one of the things that we always recommend for our organizations that we work with, is that put in that money, resource, and time, because you don't want to hear from folks and then not be able to respond at least to some of those issues.
And if an organization isn't ready to sort of use this officially, what can happen is that the leader can just have this as a prompt for them, for their thinking, right? That never becomes a part of an official thing that you do. So, I did see a question here about if we would reissue the slide deck without the forbidden word list. Is that something folks want? Deepti, is that something you can tell me offline?
I think the person that asked that question had to leave, but I can connect with her
Okay.
on
Okay. I
on
mean,
that as
we
well.
can. I will just say personally, our choice has been to go full speed ahead until somebody tells us stop. I realize that's not the choice for everybody or that everybody's able to make. And so if there is a request to reissue that, if you could please let me know what you would like us to take out. I will reissue that with it taken out. Some of the words we have about harm, we haven't said anything on the tool or the Surgeon General's framework that isn't still up on the federal government website itself. The DEIB words are ours and we can remove those, but everything else is on the Surgeon General's website itself still. So just let me know that. Okay. Yeah, so we're at 10. Thanks for all of your questions, everybody. We appreciate that. Great discussion. And please, our contact information is in the slides, as well as a link to our website. And yes, this can be applied to back office as well as front office, any type, not just healthcare providers. We've applied it everywhere. And yeah, we'd love to chat with any of you more if you have more questions offline. So thanks so much.
Thank you, everyone.